with that then, your time starts now. Reading time is over. Next time.
Okay, no worries. Laura, my name's Tamir, one of the dogs. What can I do for you today?
Just really worried. I've had some bleeding and I'm pregnant and it's early stages and I'm just freaking out.
I can see that. I imagine having some spotting and bleeding in your first, well, in pregnancy can be quite worrying. A lot going through your mind. What's the thing you worry about the most at the moment, Laura?
Just want to know if the baby's going to be okay. You know, I've just heard that a lot of people lose their babies, and I don't know if that's going to happen to me.
Yeah, for sure. We'll go through that. Apart from what I got here, Laura, do you want to tell me in general what's been going on?
Yeah, so I'm about, I think, 8 weeks pregnant. I did a home pregnancy test a couple of weeks back, and that was positive. I saw one of the other GPs in the clinic because you were away. I couldn't get an appointment with you, and they did a blood test, and I got a phone call after, and they said that I was pregnant. But then yesterday, noticed a little bit of brownish kind of discharge. Then through the day, I've been getting more bits of spotting, and I've had to change my liner. Getting some cramps as well. Just scared.
Okay, yeah. Look, this sort of thing can happen in pregnancy, and it doesn't necessarily mean that something's wrong. But if you're happy, I'm going to ask you a few questions, and we'll see if we can figure out what's going on, okay?
Be good.
All right, no worries. So, first of all, when did you first notice the spotting?
When I woke up yesterday morning, there was like a little bit of staining just in my underwear. Didn't think too much of it, but then when it kept kind of going through the day.
Okay. And at any point, have you been having any continuous bleeding?
Well, it's I don't know. It's not so much bleeding, just spotting kind of thing. Yeah. I was on the pill years ago when I kind of got little bits of spotting then as well, and it's just kind of like that.
Okay. Have you noticed any clots?
No clots.
No clots and any tissue coming out?
That I've noticed.
Okay. That's good. And in terms of the tummy pain, it's been feeling like a period cramp. It's not too severe.
Well, you know, I don't really like my period cramps, but it's just like a normal period for me. Yeah.
Okay. No worries. All right. Have you had any vomiting?
No vomiting.
And any passing out?
No, nothing like that.
Good. Have you had any trouble with your piddling? Any burning or stinging when you urinate?
What I've noticed, but I'm probably a little bit dehydrated. I don't think I've been freaking out so much. I don't think I've really been drinking water today.
Okay, no worries. Did you end up having any ultrasound scans yet to look at how the bub's going?
Well, I was booked in for one, but I didn't get a chance to have it yet.
Oh, okay. What day is it booked for?
It's supposed to be in 2 days' time.
2 days' time. Okay. I'm gonna ask you a couple of questions that are gonna seem a bit unrelated to what's going on right now, but it's for me to understand how your pregnancy is progressing at the moment.
Yeah, sure.
How do you feel about your pregnancy?
Oh, so grateful. We've been trying for like a year and a half, and we're almost ready to give up and just let it happen.
Oh, a year and a half is quite a while. Okay. Did you end up conceiving naturally? Did you go through some sort of IVF or anything similar?
Yeah, just naturally. We tried for a year, you know, kind of a bit more strict and kind of trying to time things out. And in the end, nothing was really happening. So kind of thought we'd just have a little bit of time off and see if just de-stressing helped at all. We're thinking we'd give it one more year, and if it didn't happen on its own, then we'd have a chat about getting a referral or something. But yeah, it happens.
Yeah. I can see why you're really anxious about making sure this pregnancy goes well. Have you got any issues at all with your partner? Any kind of abuse, any violence going on at home?
Nothing like that. No, he's great. I
Fantastic.
haven't actually
Yeah.
told him yet. I don't want to freak him out in case it is nothing, but
Okay, understood. And in terms of anxiety or depression, any concerns there from your end?
I get a little bit anxious from time to time, but it's nothing I've ever had to kind of do anything about or see anyone.
Okay, is it something that's stopping you from doing your day-to-day activities at the moment?
No, I just sometimes I can feel myself kind of winding up more than I know I probably should.
Hmm.
Not letting things go. I guess.
Yeah. And have you had a chat to the previous GP about first trimester screening?
Yeah, I had a bunch of blood tests done when I first got the positive urine test.
Oh,
They said
okay.
everything there was perfect.
Okay, that's good. So, there's, as far as what's going on now, the main thing you're worrying about is a miscarriage, and it is a possibility, but it's not the most likely thing. If you're happy, I'm going to tell you a bit about what might be happening.
Yeah, that'd be great.
Yeah, okay. So, like I said, miscarriage can present with what you're experiencing, and at the moment, right now, there's no way for me to tell without sending you for a scan. That's something I'm going to do urgently, to send you for an ultrasound scan. If it is miscarriage, then we'll be able to detect that on a combination of scan and blood tests. And if that's what's happening, I'll talk you through what we can do in an upcoming consultation.
The scan tells you if I'm miscarrying.
So now the scan can tell us. First of all, we can look at whether the bub looks viable on there. That is, if it's looking healthy or not, and it also can tell us the location of the bub. So if the bub's in the uterus, then we're happy. But if the bub's somewhere not in the uterus, but in the tubes to connect the uterus to the ovaries, that's called an ectopic pregnancy, and we got to make sure that that's not what's happening, because that can be an emergency for you. It can lead to pretty bad outcomes. It needs to be dealt with. Okay. What can often happen is something called an implantation bleed. So when a bub is attaching to the uterus, you can get a bit of bleeding, and that's a normal process, which is why I said that it's not necessarily something bad happening at the moment. The less likely possibilities in your case would be anything to do with cervical cancer. I see you had a pap smear a year ago, so it's very unlikely to be that. Sometimes an infection down there, like sometimes a sexually transmitted infection, can present with a bit of bleeding. Not very likely, but it's also something that we'd like to check with a swab.
Oh, I had a check 2 years ago when I first started dating a partner. There was nothing there then. I don't think it's
Very unlikely, but we wouldn't be doing our due diligence if we didn't recheck, and it's something we check normally with a pregnancy anyway.
okay.
Okay. Let's have a look. Just bear with me for a second.
Do you think my baby's going to be okay?
Hopefully. I don't see any reason to suspect anything sinister at the moment. Did you have any questions about the sort of what I just talked you through?
So you said you're going to get a scan for me. Is that do I book that in, or where do I go to get that?
Yeah. So what we'll do, I'll give a ring to the place that's going to do your scan, and I'll see if they can fit you in urgently today, and they'll give me a ring with the result. Okay. And that's mainly to make sure that you don't have an ectopic.
Yeah.
If that's the case, I'll need to send you to the hospital straight away. Do you know much about ectopic pregnancies?
You just said something about the baby's not in the right spot.
Yeah, so rarely a baby can implant in the tube that connects the ovary to the uterus, not in the uterus itself. If you have a pregnancy like that, it can cause bleeding and it can cause pain, and a pregnancy like that is not viable, so it cannot progress to fruition. If you know what I'm saying, that pregnancy has to be terminated. Hopefully that's not what's going on with you, and it can be really distressing if it is. But if we don't address it quickly enough, it's something that can lead to a lot of harm for you and even death. It's something we need to rule out quickly and definitively. Okay. If the scan looks okay, then what we'll do is we'll keep an eye on you. We'll repeat your blood test, that pregnancy level blood test, in 2 days, and make sure it's rising well. If it looks like the test isn't rising as well as it should in a normal pregnancy, we might be looking at a miscarriage. Do you know much about miscarriages, Laura?
Just that a lot of people have them.
So they're quite common. Once you start having a miscarriage, there's no way to really stop it. And a miscarriage is often a way for a fetus that's never going to be viable due to a genetic problem, due to some problem that cannot be fixed. It's a way for the body to end that pregnancy and sort of move on. I can understand how distressing that can be as well, especially having been trying for 1.5 years. And if that's what we're looking at, I'll talk you through what can be done. And broadly, if it's a miscarriage, you can either let the body do its thing and expel the fetus. You can have a medical termination, just like you would if you were having an abortion, or you can have a surgical termination where a doctor puts you under anesthetic and removes the unviable fetus from uterus.
You said you didn't think that's what I had, so I'm not gonna have to worry about that, right? Yeah.
Not right now, but it's a possibility. So I just want you to keep in mind that's what may be happening, just to give you a heads up.
I'll go and I'll get this scan organized. And you said there was some blood tests as well. Get those again.
So I can see some of the blood test results here. I don't see some of the other ones that I would have liked you to have as part of a normal pregnancy. There are some tests to see if you're immune to certain things like rubella, varicella. There's tests of your kidney function. There's a urine test. There's a sugar test. I'll just make sure to see whether that's been requested and done already, or if it's something we need to request for you. Okay.
I think the other doctor did that. Maybe the results
already done all that,
but they said everything was fine.
Okay. Oh, that's good. Okay, fantastic.
Should I tell my partner, or do you think?
Look, it's up to you ultimately, but I think if it sounds like you have a good relationship with your partner, probably confide in them, because it can be quite a distressing time, and they're also involved in the pregnancy. I think it'd probably be better for the both of you, mental health wise, to disclose to him what's going on and let him support you through the process.
Is there anything else I need to be doing then?
Yeah, just let me have a quick look. I'll give you a call once the result comes in later today from the scan, and if you don't hear from me, I'd like to see you in 2 days just to make sure you're going okay. Last thing to tell you, sometimes if it is an ectopic pregnancy or a miscarriage, you can become quite unwell. I'd like you to know the signs of becoming really unwell and head to hospital straight away if that happens. So the signs are if you're having continuous bleeding for more than 30 minutes, if you're passing larger clots, if you're vomiting, if you're feeling lightheaded to the point of passing out.
And you've just run out of time. But I think you got enough of those through, though. I think that was still quite well done. And I think all in all, fantastic then, mate. This is a challenging case for a lot of people, and it's something that isn't an uncommon presentation for general practice. I could just sit there and listen to you read all day. You have a really lovely voice, nice and calm, nice and soothing, and particularly for these kind of high stress, high emotion kind of cases, that's the kind of approach you want to be, that calm in the storm. Particularly when there's those little flags, little hints in there that this is a patient that may be prone to anxiety. So the more you can do to help settle things down, the better. I did fish a little bit, but the thing about telling the partner is I think an important thing to reinforce that, hey, look, things aren't fantastic right now. There is some uncertainty here, but it's probably time to just activate the support network to prepare for any kind of eventuality. And I think you did that in a way that was very, very well done in that you didn't say, look, you have to tell your partner. It's kind of up to you, but they are a support for you, and acknowledge there's a mental health impact, not just you, but also for the partner who is also in. But that was really well done. Very appropriately, you flagged early on that, hey, we don't know where this pregnancy is. So this could be miscarriage. This could be just benign early bleeding, early pregnancy bleed. Versus this could be something dangerous and life-threatening. I particularly like the way you slowly introduce that concept to kind of say, look, everything's probably okay. And if we go statistics, things are probably okay. But hey, there's these other things. You almost ran out of time getting those red flags for ectopic pregnancy. And so I probably would have brought that in a little bit sooner. That's kind of one of the big things that you need to make sure you've conveyed to the patient. But I think as well, I did intentionally keep interrupting you when you were saying, oh, can I just have a moment to through? Yeah. And a part of that is, on these cases, you don't always have the time to get through everything. And interruption. How do you feel you went all in all?
Not my area of expertise. I was a bit jumbled with all the pregnancy things you have to tick off.
I think you did well. Probably the one other recommendation I would have is if there is that uncertainty and some symptoms, have that lower threshold to say, look, there's a lot of things we need to do pretty quickly. It may be easier to actually get you through to ED, to have things followed up there. If things are well, though, and this was intentionally a patient that was relatively stable, pretty sensible, I don't think it was all would work against you to say, hey, I can call this place, and if we can get you in nice and quick, then yes, we can. But probably just flag, I'm also acknowledging the high emergency of if there is delays there, then ED probably is the port. Does that make sense?
Yeah.
I think you would have passed. I think, as you've kind of hinted, this probably is a topic that you could do a little bit of reading on just to polish up that little bit more, to go from the pass to well and truly pass without any question and wow, isn't he polished? But I think your communication style certainly did you many, many favours for that. Well done. And I've just seen as well for the feedback, I haven't updated the right slides, so apologies for that. Any other questions, comments, or queries?
No, I'm good. Thanks, Kane.
Thanks very much for joining, mate. Hope to see you for another case later on.